Session with Hema Haridas from Tiju Sir Academy, Tiruvalla. So let me wait a few seconds for everyone to join. And I hope all of you are doing well. എല്ലാവരും സുഖമായിട്ടൊക്കെ ഇരിക്കുന്നു എന്ന് വിചാരിക്കുന്നു. Yes, Johnny, good morning. Okay, so rest of the students, how is your speaking sessions going? എങ്ങനെയുണ്ട് സ്പീക്കിംഗ് സെഷൻസ് ഒക്കെ അത്യാവശ്യം ഓക്കെ ആയിട്ട് പോകുന്നു, നല്ല രീതിയിൽ ഇമ്പ്രൂവ്മെൻ്റ് ഒക്കെ ഉണ്ടോ? So do you have any specific doubts to ask? Like warm up session അല്ലെങ്കിൽ like എന്തെങ്കിലും ഒരു ക്രൈറ്റീരിയ? Do you have any doubts? Bindu, good morning. Sudeep, good morning. If you have any doubts regarding like any warm-up questions or any other thing, you can ask it. If it is a very big topic which we need to discuss, means we can bring it in our next upcoming lives. If it is a very short topic, we can definitely do a discussion right now. Yes, Jisha, good morning. Jibi, good morning. Manu, Anish, good morning. Divya, N, good morning. Jinsi, Febin, good morning. Okay, so you can comment down your doubts. എന്താണ് നിങ്ങൾക്ക് ഫീൽ ചെയ്യുന്നത്, അല്ലെങ്കിൽ ഇപ്പം നിങ്ങൾക്ക് തോന്നുമല്ലോ you are weak in something. Maybe it can be usual warm-up questions. Bindu, did you mean the common questions that we say like introduce yourself, why did you choose nursing, അങ്ങനെയുള്ള നമ്മൾ കോമൺലി ചോദിക്കുന്ന ക്വസ്റ്റ്യൻസിലാണോ ഉദ്ദേശിക്കുന്നത്? ഓക്കെ, ആൻഡ് അഞ്ജുമോൾ, ഗുഡ് മോർണിംഗ്. ആൻഡ് നെക്സ്റ്റ് ലിജി ജോബി, is it important to add title throughout speaking? Okay, is it important to add title? Okay, if they specifically mention that, it is important. Like you can call me Mr. John. So in that case, we need to address them with Mr. But if they didn't mention, okay, for example, I can give you that is, in European countries, Ellen, this name can be addressed for both male as well as female. Okay. So another only option is to check on their gender and say. But it is better if they are comfortable with, if they are saying, I'm comfortable by calling me Ellen, you can just address them with that. There is no need to add any title. Okay. So I hope it is clear, Liji. Chinju, good morning. Liksa, good morning. Sitara, good morning. Okay, I can see so many new students. Okay, Bindu, I can definitely do a live session for that, because നമ്മളിപ്പം അതൊരു ചെറിയ ടോപ്പിക് അല്ല, ഇറ്റ് ടേക്സ് ടൈം. നമ്മളത് എക്സ്പ്ലെയിൻ ചെയ്തൊക്കെ വരുമ്പോഴത്തേക്കും കുറച്ച് ടൈം എടുക്കും. ഓക്കെ, യാ, സോ ഐ വിൽ ഡെഫിനറ്റ്ലി ഡു എ ലൈവ് സെഷൻ ഫോർ ദാറ്റ്. ഗ്രീഷ്മ, ഗുഡ് മോർണിംഗ്. ജോമെറ്റ്, ഗുഡ് മോർണിംഗ്. Rakesh, hi. James, Josman, Liji, yeah. Donna, yeah, good morning all. Okay, so is there anyone else who has any doubts? Do you prefer any specific role play cards? Last time you asked me to do a parent and child case. So last time nammal oranam cheyidu, and today it is going to be a reluctant bystander case. So do you want any other specific role plays? Donna, can you explain home visit? Donna, എങ്ങനെയാണ്, ഇൻ ജനറൽ ആണോ ഡോണ ഉദ്ദേശിക്കുന്നത്, അതോ ലൈക്ക് ഒരു ഇന്ന ടോപ്പിക്, ഇപ്പം ജനറൽ ഹോം വിസിറ്റ് അല്ലെ റുട്ടീൻ ഹോം വിസിറ്റ്, അങ്ങനെ ഒരു ടോപ്പിക് ആയിട്ടാണോ? ഹോം വിസിറ്റ് ടൈപ്പ് ക്യൂ കാർഡ്, പ്ലീസ് എക്സ്പ്ലെയിൻ. ഓക്കെ, ഡോണ, we had already done I think 2 live sessions, so can you please go through that? കാരണം നമുക്ക് I'll give you an explanation, but I can definitely bring up another role play card with the home visit. Okay, routine visits, all right. So does any other students have any doubts? വേറെ എന്തെങ്കിലും doubts, or should I bring up another live session, അല്ലെങ്കിൽ ഇന്ന കാർഡ്, അങ്ങനെ എന്തെങ്കിലും preferences? You can comment down your answers. School health role play. Okay. Yes. Any other students? വേറെ എന്തെങ്കിലും കാർഡുകൾ നിങ്ങൾക്ക് വേണം, അല്ലെങ്കിൽ ഇങ്ങനത്തെ കാർഡ് ഐ ഡോണ്ട് നോ ഹൗ ടു പ്രസൻറ്റ്, അങ്ങനെ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ can you please comment down? School health role play card. Okay, Divya, I can definitely do that. And for the rest of the students? Okay, so I hope everyone is clear. Okay, so can you tell me what all are the difficulties that you face? Because it's been 2 to 3 months that we are doing these live sessions regularly. ഒരു 2-3 മാസമായിട്ട് ഇപ്പോൾ നമ്മൾ റെഗുലറായിട്ട് ലൈവ് സെഷൻസ് ചെയ്യുന്നുണ്ട്. സോ നിങ്ങൾക്ക് ഓക്കെ ഇതിൽ ഞങ്ങൾക്ക് ഇങ്ങനെ ഒരു കാര്യം വരുവാണെങ്കിൽ കുറച്ചുകൂടെ ഹെൽപ്ഫുൾ ആയിരിക്കും, അല്ലെങ്കിൽ ഇങ്ങനെയാണെങ്കിൽ നല്ലതായിരിക്കും. ഡു യു ഹാവ് എനി സജഷൻസ് ഓർ അങ്ങനെ എന്തെങ്കിലും ഉണ്ടോ? Josna, vaccination cards and burn patient. Okay. Vaccination card and burn patient. Okay, we can definitely do that. Then, yes, Ashwini, Archana, yes, good morning. Janil, bedwetting case. Okay. Bedwetting, is it like conversation with the patient or with the patient's relatives, that is the parents? Whom do you prefer, Janil? കാരണം രണ്ട് രീതിയിലും നമുക്ക് കോൺവെർസേഷൻസ് ഉണ്ടാകാം. Both are the possibilities. So which one do you prefer? Bedwetting. Okay, warm-up questions. Okay, do you prefer the recent warm-up questions or do you want just the usual thing? If 2 people doing role play card is good. Okay. Yeah. Bedwetting is both cases. All right. Maternity visit. Okay. Yes. So I think everyone has addressed the okay, recent warm-up questions. Yes. So the next live will be about the recent warm-up questions and some of the topics. Just in general, what all are the topics and what all are the things. Okay. So now I think we can move on to the role play part. Aged care assessment. All right, we can definitely do that. So this is our role play card. So you may please go through it. All right. Yes. So the nurse setting is emergency department. So in this card, the designation is already given. You are a nurse in the emergency department of a public hospital. So designation already thannittund. Next, you are short-staffed and available doctors are dealing with the patients on critical priority basis. നമുക്ക് ഓൾറെഡി സ്റ്റാഫ് ലിമിറ്റേഷൻസ് ഉണ്ട്. അറ്റ് ദ സെയിം ടൈം, അതായത് വി ഓൺലി ഹാവ് ലിമിറ്റഡ് സ്റ്റാഫ് അവൈലബിൾ ആൻഡ് ദ ഡോക്ടേഴ്സ് ആർ സീയിങ് ദ പേഷ്യൻസ് ആസ് പെർ ദ ക്രിട്ടിക്കൽ കണ്ടീഷൻ. ആ ഒരു അവരെത്രത്തോളം സിവിയർ സിറ്റുവേഷനിലാണ് നിൽക്കുന്നത് അതിൻ്റെ ബേസിസിലാണ് പേഷ്യൻസിനെ ഡോക്ടേഴ്സ് കാണുന്നത്. An aggressive person who has obviously been drinking has demanded a doctor to see the mate with a suspected broken arm immediately. Okay, so the first thing, we may not be familiar with every word in our role play card. So if you see this word like aggressive, agitated, so if you have any doubts like these, you can ask during your preparation time. Excuse me, ma'am, can you please tell me the meaning of this word? So you can ask that and you will get a simple explanation. Okay. So an aggressive person, aggressive എന്ന് ഉദ്ദേശിക്കുന്ന കുറച്ച് വയലൻ്റ് ആയിട്ടുള്ള ഒരാൾ. An aggressive person who has obviously been drinking, കുടിച്ചിട്ട് വരുന്നു, has demanded a doctor see their mate. See their mate എന്ന് ഉദ്ദേശിക്കുന്നത്, the mate means his or her friend, with a suspected broken arm. Suspected in the sense they doubt that his friend is having a broken arm. So this person demands that his friend needs to be seen immediately because they are suspecting that his friend is having this broken arm. Okay, so next, moving on to the first task. Introduce yourself and explain your role. So can you tell me whether this is a known or an unknown case? Known case aano ado unknown case aano? You can comment down your answers. Is it like a known case or an unknown case? What do you feel about this conversation? Known aano ado unknown aano? Endana? Okay, Deepthi, yes. Okay, unknown. And rest of the students? Velangit Aruna, unknown. Meenu, unknown. Unknown, yes. Nimi, Donna, Archana, yes, unknown. So all the students are right. Yes, it is an unknown case. Okay. Yes, and yes, it is an unknown case. So the first one, introduce yourself and explain your role. Yes, Grishma and Priji, yes, it is an unknown case. So can you tell me how we are going to start this conversation? This is an emergency department case. So how are we going to start? Yes, Ashwini, Raji, Anjumol, yes, this is an unknown case. Okay, so how are we going to start our conversation? എങ്ങനെയാണ് നമ്മുടെ കോൺവെർസേഷനെ നമ്മൾ സ്റ്റാർട്ട് ചെയ്യാൻ പോകുന്നത്? Okay, you can comment down your answers. You can type in short forms. നിങ്ങൾ ചെറുതാക്കിയിട്ട് ഷോർട്ട് ഫോം ആക്കി എഴുതിയാൽ മതി, കാരണം ഫുള്ളായിട്ട് എഴുതുമ്പോൾ ടൈം അത്രയും പോകും നമുക്ക്. So you can type in short forms. Gritty, yes, it is an unknown case. So this is a conversation with not a patient but with the patient's bystander, and it is an emergency department. So how are we going to give our introduction? Okay, we do wish them. That is എങ്ങനെയാണ്? Like good morning, good afternoon or good evening. Okay, so I need to ask everyone a question. That is, can we use hi or hello to start our conversation? Hi or hello നമുക്ക് ഒരു conversation start off ചെയ്യാനായിട്ട് യൂസ് ചെയ്യാൻ പറ്റുമോ? പറ്റുമോ പറ്റില്ലേ? Just yes or no. Is it possible or not? Then introduce our role. All right. Okay. So in this, good morning, I'm Aruna, one of the registered nurses working in this emergency department. Good afternoon. Okay, Adira, no. Gritty, no. Grishma, possible. Deepthi, no. Okay, ma'am, could you please tell me like cases which are known, which are unknown or not heard cases? How to do speaking? They are like bunion surgery. Okay. Jinil, do you prefer like a conversation that is with the patient or with the patient's relative who had underwent a bunion surgery? Is that what you prefer? Okay, Donna, yes. So the answer is, it is better not to use this hi or hello in order to start the conversation. Why? Because whenever we are introducing ourselves or whenever we are going to start a conversation, hi and hello is considered as an informal greeting. Informal in the sense, when we are having a conversation with someone who is very close to us, who is not having like, there is no need to have a professional like a space. It is not a professional space. It is a space where we can act very freely. So hi and hello എന്ന് പറയുന്നത് ഒരു ഇൻഫോർമൽ ഗ്രീറ്റിംഗ് ആയിട്ടാണ് കാണുന്നത്. സോ ഹായ് ആൻഡ് ഹലോ നമ്മൾ മാക്സിമം കോൺവെർസേഷൻസിൽ സ്റ്റാർട്ട് ഓഫ് ചെയ്യാനായിട്ട് യൂസ് ചെയ്യത്തില്ല. ആൻഡ് വെൻ വി ആർ ഡൂയിങ് എ കോൺവെർസേഷൻ, ഇറ്റ് ഈസ് എക്സ്ട്രീംലി ഫോർമൽ. That is, we are having a conversation with a patient in our professional space. നമ്മൾ ഒരു പ്രൊഫഷണൽ ആയിട്ട് നിന്ന് നമ്മൾ സംസാരിക്കുന്നതാണ്. So it is better not to use hi or hello. So I hope it is clear. Next, general emergency department unknown case. All right, yes. Which are known or not heard cases? How to do speaking? They're like bunion surgery. Okay. Janil, if you can make it more clear, it would be much better. Okay, because I didn't understand it from your explanation. Okay. Yes. So introduce yourself and explain your role. So we are going to start with our greetings, that is good morning. So whenever we are giving our introduction as well as our greetings, please do give a space in between them. ഈ good morning പറഞ്ഞ് ഒറ്റ സ്ട്രെച്ചിൽ ഇൻട്രോ കൊടുക്കാതിരിക്കുക. Instead, good morning പറയുക, let them introduce. Let them greet you back. After that, you can give your introduction. Okay. So what if the interlocutor is responding to your greeting like, nurse, I don't know what's happening here. We have been waiting here for the past 1 hour. And I don't know why there is a delay. So in this situation, how will you put your conversation forward? എങ്ങനെയാണ് conversation മുന്നോട്ട് കൊണ്ടുപോകാൻ പോകുന്നത്? Will we focus on our introduction? നമ്മുടെ intro focus ചെയ്യുമോ? ഇപ്പം ഞാനിവിടെ 1 മണിക്കൂറായി വെയിറ്റ് ചെയ്യുന്നു, എനിക്ക് മനസ്സിലാവുന്നില്ല എന്തിനാണ് ഇത്ര ഡിലേ ഇവിടെ എന്നുള്ളൊരു ക്വസ്റ്റ്യൻ ചോദിക്കുമ്പോൾ, വിൽ യു ഫോക്കസ് ഓൺ യുവർ ഇൻട്രൊഡക്ഷൻ ഓർ ജസ്റ്റ് നോർമലി നമ്മളങ്ങ് പോവാണോ? Okay, Tintu has commented no. Gritty also no. Address that concern. Yes, Gritty, that's right. We need to address that concern. After addressing that, you can introduce yourself. Okay, you can use let me introduce myself or let me introduce, and you can introduce yourself. In this, it is given, my name is, I'm a nurse working in this emergency department of this public hospital. Okay, so how are we going to address that concern? നമ്മളൊരു 1 hour ഡിലേ ഉണ്ടായി എന്നുള്ളതിനെ പറ്റി how are we going to address that concern? We have been waiting here for the past 1 hour and till now we weren't able to see the doctor. So how are we going to address this concern? എങ്ങനെയാണ് ഈ കൺസേണിനെ നമ്മൾ അഡ്രസ് ചെയ്യാൻ പോകുന്നത്? Okay, sorry for the delay. Okay, Shinsha, we can use that. കുഴപ്പമില്ല, but കുറച്ചുകൂടി you can make it more elaborate. Donna, I can understand your situation. I'm really apologize. Okay, Gritty, I am really apologize the delay. Alla, I apologize for the delay. ആ ഒരു താമസം ഉണ്ടായതിന് സോറി എന്നുള്ളത്. I'm so sorry to hear that. First day, sorry, then start introduce. Okay. First, you can, Ashwini, there is a slight correction. When we greeted, they just told, when we greeted them, they told you that, okay, ingana korchu issues undu. They just mentioned that. So, at the next point, when they are expressing their concern, then you can just address it, and after that you can introduce. Yes, ma'am, all medical conditions are not heard or not really known to us. Those speaking cards, can we ask that condition to the interlocutor? Thank you. Janil Thomas, it is better not to ask about the medical conditions even though we are not familiar with that. So it is better that you get a clarity about the common conditions that are used, that are very common in our role play cards, like bunion surgery, breast encroachment, breastfeeding techniques. And in our recent exams, we are getting a lot of psychiatric cases like bipolar, sleeping disorder, and other conditions like dementia, Alzheimer's. Like, we are getting so much of those conditions. So if we can check for the layman's term and have a quick note of it, it will be helpful for you to revise on your exam day. Okay? Yes. So I hope it is okay till now. And next, explain your role. Okay. So we just told I'm the nurse working in this emergency department. And next, how are we going to explain our role? എങ്ങനെയാണ് നമ്മുടെ റോളിനെ നമ്മൾ എക്സ്പ്ലെയിൻ ചെയ്യാൻ പോകുന്നത്? How are we going to do that? എങ്ങനെയാണ് നമ്മൾ നമ്മുടെ റോൾ Okay, so in this case, we can just say, okay, I'm a nurse working. We already gave them an introduction and the role is very clear. We are the emergency department nurse. So next thing what we need to ask is, okay, what brings you here today, or how may I help you? I'm one of the registered nurses working in this emergency department. Yes, Deepthi. Next, acknowledge their concern for their mate. So before that, we need to make them tell, okay, they had came for their friend's problem, not for their personal needs. They just came for their friend's difficulty or the friend's problem. So we need to ask, okay, what exactly happened, or what brings you here today? So on the next line, you can just say, so in this case, this friend and this bystander, they both went for a football match, and when they were coming back, they had a few drinks, they had an argument, and they just his friend fell down, and that's how they are coming to the hospital. So this is what exactly happened. So we need to, whose name we need to document? Is it the patient's, like the mate's name, or is it this person whom we are speaking to? Whose name should we document? ആരുടെ പേരാണ് നമ്മൾ ശരിക്കും ഡോക്യുമെന്റ് ചെയ്യേണ്ടത് ഈ ഒരു കേസിൽ? Yes, patient name. So this is already a conversation which started like a non-cooperative one. ഒട്ടും അത്ര കോപ്പറേറ്റ് ചെയ്യാത്ത രീതിയിൽ സ്റ്റാർട്ട് ചെയ്യുന്ന ഒരു കോൺവെർസേഷൻ ആയതുകൊണ്ട് തന്നെ there are chances that they may ask you, okay, why it is necessary, or is it really necessary to do these things? ഇങ്ങനൊരു ക്വസ്റ്റ്യൻ വരാൻ സാധ്യതയുണ്ട്. So acknowledge their concern for their mate. Okay, don't worry, your friend is at the right place and we all are here to help you. So before proceeding further, may I ask a few details regarding your friend's condition, or regarding your friend? Okay, after that you can ask how it happened, and for my documentation purpose, can you please tell me your friend's name and age? Okay, your friend's name and age. Next, is there anything else we need to ask? വേറെ എന്തെങ്കിലും ഡീറ്റെയിൽസ് നമുക്ക് കളക്ട് ചെയ്യാനുണ്ടോ ഈ ഒരു കേസിൽ? You can comment down your answers. എന്തെങ്കിലും questions ചോദിക്കാനുണ്ട് അല്ലെങ്കിൽ ഉണ്ടോ? Should we ask anything else? We already asked what happened and we documented this patient's name and age. Name ഉം age ഉം document ചെയ്തു. Anything else which we need to ask? വേറെ എന്തെങ്കിലും കൂടി നമുക്ക് അതിൻ്റെ add on ചെയ്യാനായിട്ടുണ്ടോ? Yes, Bindu Kurian, bystander name. Okay, so how can we ask the bystander's name? Bystander's പേര് നമുക്ക് എങ്ങനെ ചോദിക്കാം? Next of kin to report the issue. Okay, Sansi. Okay, we can say that. Can you please tell me about your friend's family? So we need to ask that question if we need to report this issue and all. Okay. For my better communication, can you please tell me your name? Okay, for my better communication. Or we can directly use, yes, Tintu, we can use that. How may I address you? We can use these. Next, is the first two tasks clear for everyone? Do you have any doubts? For better communication, could you please tell me your name? Yes, Nimi, we can use that. Okay. So, is the first two tasks clear for everyone? May I know your name for my better communication? Yes, Deepthi, we can use that. Alright, so I hope till now it is clear. For communication purpose, Grishma, there is a slight correction. For my communication purpose, may I know your name? For communication എന്ന് പറഞ്ഞാൽ നമ്മൾ സംസാരിക്കണം, അപ്പം അതിന് വേണ്ടി പേര് പറ, അങ്ങനെയല്ലല്ലോ. എനിക്ക് നിങ്ങളോട് കുറച്ചുകൂടി ക്ലാരിറ്റിയോട് കൂടി സംസാരിക്കണം, അപ്പം അതിന് വേണ്ടി നിങ്ങളുടെ പേര് പറയുക. ഓക്കെ, നെക്സ്റ്റ്, ഹൗ മേ ഐ ഹെൽപ്പ് യു? ഓക്കെ, ഇൻ ദ ബിഗിനിങ് വി ക്യാൻ യൂസ് ദാറ്റ്. ആൻഡ് സി, for better conversation, if you want, you can say like, for our better conversation, could you please tell me your name? നമുക്ക് കുറച്ചുകൂടി ബെറ്റർ ആയിട്ട് കമ്മ്യൂണിക്കേറ്റ് ചെയ്യാൻ വേണ്ടി നിങ്ങളുടെ പേരൊന്ന് പറയാമോ? Okay, so I hope it is clear. For our better communication, may I know your name? All right, yes, Ashwini, we can use that. Next, moving on to the third task. Explain that a triad nurse has reviewed their friend and that they will be seen as soon as possible. So how are we going to begin this? What all are the phrases we can use to calm down some reluctant cases? Okay, Susan. Yes, I can definitely say some of the phrases in this card itself. Okay, so please put your mind at ease. This is the first phrase which you can use to calm up. It can be a patient or a patient's relative. Okay. Don't worry, your friend is in our safe hands because the triad nurse has already reviewed him and you will be seen, or your friend will be seen very soon or as soon as possible. Okay. So I had mentioned two phrases now. Put your mind at ease, or you can use your friend, or you are in our safe hands. In this case, we are having a conversation with the patient's bystander. So we are just mentioning your friend is in our safe hands. Okay. So these are the two things which you can use. Another one you can use is please be assured. These are the three phrases which you can use. We can also use there is nothing to be overly concerned about it. Okay. So these are the phrases that you can use. So how are we going to explain the third task? Yeah. So how are we going to say, explain that a triad nurse has reviewed their friend and that they will be seen as soon as possible? എങ്ങനെ പറയാൻ പറ്റും? You can use, I would like to inform you. You can use that. നമ്മൾ കുറച്ച് formally we are informing them that okay, this thing has already happened. I would like to inform you that a triad nurse has already reviewed your friend and your friend will be seen very soon. Instead of as soon as possible, we used very soon. Okay. If you can change the vocabs, like some slight changes also, it's fine. Okay, so is the third task clear for everyone? Do you have any doubts? Any doubts in this third task? Can you please comment down so that we can move on to the next task? Okay, so I hope till now it is clear for everyone. Okay, next, explain that the patients are seen in order of medical priority and not arrival time. Okay, so how are we going to explain the fourth task? Please repeat the task. Okay, explain that a triad nurse has reviewed their friend. The triad nurse has reviewed their friend means the nurse, another nurse, it's not us, another nurse has already checked their friend and they will be seen very soon. And we are just informing them that, okay, your friend will be seen very soon. So we are just informing them because in this case, this bystander in the beginning is telling us that, okay, we have been waiting here for the past 1 hour and no one is taking care of my friend, or nobody took care of my friend. So now we are just informing them that, okay, the triage nurse has already reviewed your friend and your friend will be seen very soon. Okay. So next, explain that the patients are, so I hope this third task is clear. And moving on to the fourth task, explain that patients are seen in order of medical priority and not arrival time. So how are we going to explain this task? എങ്ങനെ എക്സ്പ്ലെയിൻ ചെയ്യാം, അല്ലെങ്കിൽ നമ്മൾ എങ്ങനെ എക്സ്പ്ലെയിൻ ചെയ്യും? എങ്ങനെയാണ് നമുക്ക് എക്സ്പ്ലെയിൻ ചെയ്യാൻ പറ്റുന്നത്? ഓക്കെ, ഐ തിങ്ക് യെസ് ഇറ്റ് ഇസ് ക്ലിയർ. ഓക്കെ, സോ ദ ഫോർത്ത് ടാസ്ക്, എങ്ങനെയാണ് നമുക്കിത് പ്രസൻറ്റ് ചെയ്യാൻ പറ്റുക? Okay, you can comment down your answers. Okay, എങ്ങനെയാണ് നമ്മളിത് പ്രസൻറ്റ് ചെയ്യുന്നത്? So, okay, I think most of them are confused in this card, I guess. So, explain that the patients are seen in order of medical priority and not arrival time. So, the common phrase that we use is, as I told you before. So, told, whenever we are using this word told, it will sound a bit rude. നമ്മൾ rude ആവാൻ ഉദ്ദേശിച്ചില്ലെങ്കിലും it may sound a bit rude. Okay, so for that you can say, as I had mentioned earlier, the triage nurse has already reviewed your friend and I would like to tell you that the patients are seen as per their medical priority and not based on their arriving time. So how critical the condition is, how far that much fast the doctor will assess. If triage nurse is not addressed in any other role play, can we use like the triage nurse assisted like that? No, Susan, we cannot use that. In this it is specifically given. That's the reason why we used it. Okay. The same thing goes for assessment also. If there is no specific assessment information given, or it is not given like, okay, this site is infected or anything. If it is not given, it is better not to say that. I'm so sorry to say that. Normally we see the patients. Anjali, normally the doctors see the patients. Okay? It is not we. We can use normally the doctors see the patients according to their condition rather than their arrival time. Okay. You can also use, I'm so sorry to inform you that. Instead of say, you can use inform. Inform is more formal. Okay? I can really understand your concern, but Mr. X, this is an emergency department, so the doctor checked the patients according to their medical priority. Specify that, because time is also a priority. Okay? Ashwini, the rest of the things are all right. We see the patients according to the priority cases. We see the patients according to their medical priority. Nimmi, just add that word, medical priority. Okay? Deepthi, I can understand you have been waiting here for 1 hour. You can use here for 1 hour. The doctor will see the patients depending on the medical condition and not based on their arrival time. Okay. There are some slight grammatical errors, Deepthi, so please correct that. Okay, so we can say, I'm so sorry to inform you that the patients are seen as per the medical priority and not based on their arrival time. And moreover, the triage nurse has already reviewed your friend. So please don't worry, it may take some more time, but your friend is in our safe hands, so please don't worry about it. Or you can use, please put your mind at ease, or please relax yourself. Next, let the person know that he is disturbing other patients. So if your interlocutor is extremely rude, or if they are really what to say, if they are really increasing their tone or increasing their voice, you can use this task, or else it's not really necessary. ഇപ്പം ഒട്ടും അങ്ങ് സൗണ്ട് ഒന്നും റേസ് ചെയ്യാതെ വളരെ കൂളായിട്ട് സംസാരിച്ചുകൊണ്ടിരിക്കുന്ന ഒരു ഇൻ്റലക്യൂട്ടർ ആണെങ്കിൽ ചുമ്മാ പോയിട്ട് നിങ്ങൾ സൗണ്ട് കുറയ്ക്കുന്നതാണ് നല്ലത്, കാരണം നിങ്ങൾ മറ്റുള്ള പേഷ്യൻസിനെ ഡിസ്റ്റർബ് ചെയ്യുന്നു എന്നുള്ളൊരു ഫ്രേസ് പറയുന്നതുകൊണ്ട് പ്രത്യേകിച്ച് ഗുണമൊന്നുമില്ല. സോ ദിസ് ഇസ് ആൻ ഓപ്ഷണൽ ടാസ്ക് ഡിപ്പെൻഡിങ് ഓൺ യുവർ ഇൻ്റലക്യൂട്ടർ. അവർ സൗണ്ട് റേസ് ചെയ്യുന്നു, ഇഫ് യു ഫീൽ ദാറ്റ് ദേ ആർ റേസിങ് ദ വോയിസ്, or they are without anything, they are just getting so much angry at us, ഒരുപാട് ദേഷ്യപ്പെടുന്ന പോലെ ഫീൽ ചെയ്യുന്നു, അങ്ങനെയാണെങ്കിൽ you can say that. But how will you let the person know this? ഈ ഒരു ബൈസ്റ്റാൻഡറിനെ നമ്മൾ എങ്ങനെ അറിയിക്കും he is disturbing other patients? How are we going to do that? എങ്ങനെ നമുക്ക് അവരെ ഇൻഫോം ചെയ്യാം? You can use I'm so sorry to inform you that you are disturbing the other patients in this department, and all the patients are in critical stages, or you can use all the patients are in various critical stages. So if you don't mind, could you please lower your voice? Is it clear? Is it clear for everyone? You can comment down. If it is not clear, we can definitely go through the task again. Okay, can you please comment down whether it is clear or not? If it is clear, we can move on to the next task. Okay, Deepthi, yes, it is clear. Okay, lower your voice nu paranjal, it is a very formal usage. Yes, once again please. Okay, Febin, let the person know that he is disturbing other patients. അതായത് അയാൾ അറിയണം ഈ നിങ്ങൾ ഇങ്ങനെ സൗണ്ട് കൂട്ടുമ്പോൾ മറ്റുള്ള പേഷ്യൻസിനത് കുറച്ച് ഡിസ്റ്റർബിംഗ് ആണെന്ന്. പ്ലീസ് കീപ് ഇൻ മൈൻഡ് യുവർ മേറ്റ് ഇസ് ഡിസ്റ്റർബിംഗ് അതേഴ്സ്. ജസ്റ്റ് ക്ലാരിഫൈ down your mate. Okay, Nimmi, there is a slight correction. It is not the mate that is disturbing, it is the person whom we having a conversation is disturbing. നമ്മൾ സംസാരിച്ചുകൊണ്ടിരിക്കുന്നയാളാണ് മറ്റുള്ള പേഷ്യൻസിനെ ഡിസ്റ്റർബ് ചെയ്യുന്നത്, ആ കിടക്കുന്ന ഫ്രണ്ട് അല്ല. ഓക്കെ, സോ ഇതിൻ്റെ അകത്ത് ലെറ്റ് ദ പേഴ്സൺ നോ ദാറ്റ് ഹീ ഈസ് ഡിസ്റ്റർബിങ് അതർ പേഷ്യൻസ്. മറ്റുള്ള ആ ഒരു സംസാരിക്കുന്നയാൾ അറിയട്ടെ നിങ്ങൾ മറ്റുള്ള പേഷ്യൻസിനെ ഡിസ്റ്റർബ് ചെയ്യുകയാണ്. ഐ എം സോ സോറി to say that you are disturbing the other patients in this department. And as you may know, most of the patients in this department are in a very critical stage. So it would be better, or you can use, if you don't mind, can you please lower your voice? You can use that. If you don't mind use ചെയ്യുന്നത് അവർക്ക് ജസ്റ്റ് ഒരു ബുദ്ധിമുട്ടുണ്ടാവാതിരിക്കാനാണ്. They should not feel bad. So we are just asking, if you don't mind, if you don't have any problems, can you please reduce your voice or lower your voice? I can understand that it is very frustrating for you. Okay, we can use that. But can you please lower your voice, because it may cause Anjali, disturbance to other patients. Okay, so in this I can understand that you are going through a very difficult situation, but if you don't mind, can you please lower your voice, because the other patients are getting a bit disturbed. Okay, so I think it is clear for everyone. Okay, Febin, I think it is clear now. So till now, any of the students have any doubts in the first 5 tasks? ആദ്യത്തെ 5 ടാസ്കിൽ എന്തെങ്കിലും ഡൗട്ട്സ് ഉണ്ടോ? If you have any doubts, please don't hesitate to ask. Okay, so I think it is clear for everyone. Next, advise them that alcohol consumption or intoxication. നമുക്കതൊരു ഓൾട്ടർനേറ്റീവ് ആണ്. You can either use alcohol consumption or you can use intoxication. It's not permitted on the hospital premises. Okay, in this card, we already knew that they already had consumed alcohol and came to the hospital. So I would advise you that alcohol consumption is not permitted in our hospital premises. And from this task, we are moving on to the last task. Okay? If there is any kind of threatening behavior from your side, I may have to contact our security staff. We jumped from the 6th task to the 8th task. Okay, I can understand your situation, but I am also so sorry to inform you that, as you know, this is an emergency department. Your voice is disturbing others. Kindly understand that. Shine, if you can use an alternative for this, I can understand your situation. Instead of that, you can use, if I were you, I would have reacted the same way. Or, your concerns are quite reasonable, Mr. John or Mr. Jacob, whatever the name they mention. But as you know, this is an emergency department. It is not necessary to use empathy and sympathy together. You can use any one of them. But as you know, this is an emergency department and your voice might be disturbing other patients. So if you don't mind, can you please lower your voice? Okay? Next. So from our 6th task, we continued it with our 8th task. നമ്മളത് രണ്ടും കൂടെ വി ആർ ആക്ച്വലി കണക്റ്റിംഗ് ദീസ് ബോത്ത് ടാസ്ക്. ആൽക്കഹോൾ കൺസ്യൂം ചെയ്ത് എന്തെങ്കിലും ത്രെറ്റനിങ് ബിഹേവിയർ ഉണ്ടായിക്കഴിഞ്ഞ് കഴിഞ്ഞാൽ, ഫസ്റ്റ് ഓഫ് ഓൾ ആൽക്കഹോൾ കൺസംഷൻ നമ്മുടെ ഹോസ്പിറ്റൽ പ്രമൈസസിൽ അലൗഡ് അല്ല, അതായത് പെർമിറ്റഡ് അല്ല. അതുപോലെ തന്നെ ഇൻ കേസ് എന്തെങ്കിലും ത്രെറ്റനിങ് ബിഹേവിയർ ഉണ്ടാവുകയാണെങ്കിൽ നമ്മൾ ഹോസ്പിറ്റൽ സെക്യൂരിറ്റി സ്റ്റാഫിനെ ഇൻഫോം ചെയ്യും. ഓക്കെ, സോ ആ 2 ടാസ്കുകളും കണക്റ്റ് ചെയ്ത കാര്യം ഓക്കെ ആണോ? Any doubts? Any doubts in this card? ഈ ഒരു 2 ടാസ്കുകളും കണക്ട് ചെയ്തത് ഓക്കെ ആണോ എല്ലാവർക്കും? It is not necessary that you connect it. If you want, you can present it as entirely different task also. Okay? So advise them that alcohol consumption or intoxication is not permitted on the hospital premises. I would like to inform you that, or you can say, I would advise you that alcohol consumption is not permitted on this hospital premises. Next, suggest but alcohol undannu engane confirm cheyum? Sumi, in the beginning, that is, what happened എന്നൊരു ക്വസ്റ്റ്യൻ നമ്മൾ ചോദിക്കുന്നുണ്ട്. സോ ഇൻ ദാറ്റ് കേസ് ദേ ആർ ടെല്ലിങ് us that we had consumed alcohol and that's how my friend went into an argument. He was knocked unconscious. ആ ഒരു കേസ് പറയുന്നുണ്ട്. അങ്ങനെയാണ് നമ്മൾ കൺഫേം ചെയ്യുന്നത്. If you use alcohol in this hospital, it's against the hospital rules and regulations, and in case any problem from your side, we will inform to our security staff. We may need to inform ആക്കുക. We will inform. സംഭവം ത്രെറ്റനിങ്ങിൻ്റെ കാര്യമാണ് നമ്മൾ ഉദ്ദേശിക്കുന്നത്. എന്നാലും we will പറയാം, കുഴപ്പമില്ല. We will inform the security staff. Okay. Please be patient. I can understand your concern. Patients are seen according to the medical priority and not according to the time of arrival. Okay. Yes, that's right, Sats. We can use that. So, advice on the security staff action in case of threatening behavior. For your better awareness. Okay, we can use that. For your better awareness, I would like to tell you alcohol consumption is not permitted in our hospital premises, and that is our hospital rule. And I hope you are getting my points. Suggest they make arrangements to go home. So, have you made any arrangements to go home after the consultation? Consultation കഴിഞ്ഞ് വീട്ടിലേക്ക് പോകാനായിട്ട് എന്തെങ്കിലും അറേഞ്ച്മെൻറ്റ്സ് ചെയ്തിട്ടുണ്ടോ എന്നുള്ളത്. Can you please use ചെയ്യുന്ന കൊണ്ട് കുഴപ്പമുണ്ടോ? No, Needu, we can use that. According to the hospital rule, alcohol not allowed. Allow alla. Alcohol consumption is not allowed in the hospital premises. And if any problem occurs or if there is any threatening behavior, we will inform our security staff. Okay? Ashlyn, sorry ma'am, I'm a bit late. That's fine. But go through this card because we had already come to an end of our session. Yes. So suggest that they make arrangements to go home. So before giving them some suggestions, we are just asking them, have you made any arrangements to go home? വീട്ടിലേക്ക് പോകാനായിട്ട് എന്തെങ്കിലും അറേഞ്ച്മെൻറ്റ്സ് ചെയ്തിട്ടുണ്ടോ? Have you made any arrangements to go home? കാരണം ഇല്ല. If they say no, we'll make arrangements for them to go home. So if they say no, okay, don't worry, I'll make some arrangements for your friend as well as you to go home after the consultation. So you can wait here. If your friend is experiencing any difficulties, in case ഉണ്ടാവുന്ന കാര്യമാണ് നമ്മൾ പറയുന്നത്, if your friend is experiencing any difficulties, please don't hesitate to press the bell near to the bedside. And I'll be here to help you once again. So during the end of this conversation, should we apologize? നമ്മൾ apologize ചെയ്യണോ? നെസസറി ആണോ apologize ചെയ്യണം എന്നുള്ളത്? ഇതിൻ്റെ അകത്ത് there was a 1 hour delay from our side and they were not at all cooperative. അപ്പം അതുകൊണ്ട് തന്നെ should we apologize in our end? No, apologize ചെയ്യണ്ട, നമ്മുടെ സൈഡിലെ തെറ്റൊന്നുമില്ല. Okay, it is better to apologize at the end of the conversation. Okay, if you want, you can use this short staffed as a reason in this beginning part. അവർ വന്നിട്ട് ചോദിക്കുന്നുണ്ടല്ലോ, already we have apologized. Yes, we had already apologized, but till the end we are just once again apologizing to them, just because it's a fault from our side. Short staffing എന്ന് പറയുന്നത് നമ്മുടെ ഇഷ്യൂ ആയതുകൊണ്ട് we are just apologizing. So we are just telling them that, okay, so once again I would like to apologize on behalf of the nursing staff working in this emergency department, or you can use working in this ഹോസ്പിറ്റലിൽ വർക്ക് ചെയ്യുന്ന അല്ലെങ്കിൽ ഈ ഒരു ഡിപ്പാർട്ട്മെൻറ്റിൽ വർക്ക് ചെയ്യുന്ന നഴ്സസിന് വേണ്ടി ഒരു വട്ടം കൂടെ ഞാൻ നിങ്ങളോട് അപ്പോളജൈസ് ചെയ്യുന്നു. ബിക്കോസ് ദേ ആർ ടെല്ലിങ് us that okay, none of the nurse showed up till now. So they are actually pointing out a mistake from our side. So in this case we are apologizing for the other staff also. In this case, if they are mentioning that okay, nurse, ഇപ്പം നമ്മുടെ സൈഡിലെ മിസ്റ്റേക്ക് ആയിട്ടുള്ളതിന് നമ്മൾ അപ്പോളജൈസ് ചെയ്തു, നഴ്സിംഗ് സ്റ്റാഫിന് വേണ്ടി കൂടി. ഇഫ് ദേ ടെൽ us that okay, nurse, ഇത്രയും നേരത്തെ ഡിലേ ഒന്നും I was not expecting this long delay in your care, so I would like to apologize for the inconvenience. നിങ്ങൾക്കുണ്ടായ ബുദ്ധിമുട്ടിലാണ് നമ്മൾ അപ്പോളജൈസ് ചെയ്യുന്നത്. Okay? Yes. So till the end you can say thank you for your cooperation. Yes. So do you have any doubts in this role play card? Any doubts? എന്തെങ്കിലും ഡൗട്ട്സോ കാര്യങ്ങളോ വല്ലതും ഉണ്ടോ? If you have any doubts, you can clarify that now because we do have time. Please be informed that alcohol consumption is not permitted in the hospital. Okay, please be informed that. Okay, we can use that, or you can say I would like to inform. നമ്മളായിട്ട് അറിയിക്കുന്നു. Fine. Any other doubts for the rest of the students? നിങ്ങൾക്ക് എന്തെങ്കിലും ഡൗട്ട്സ് ഉണ്ടോ? ഇനി വേറെ എന്തെങ്കിലും ഡൗട്ട്സ് ചോദിക്കാനായിട്ട്? Okay, do you feel that this is a very complicated card? Because compared to all other sessions, the responses were much less in this card. I felt so. ഇത് കുറച്ച് ഡിഫിക്കൾട്ടായിട്ടുള്ള ഒരു കാർഡാണല്ലോ, ഇത് കുറച്ച് ടഫാണ് എന്ന് ഫീൽ ചെയ്യുന്നുണ്ടോ? You can comment down your answers. If you feel that it is tough, അല്ലെങ്കിൽ you have some difficulties in this card, we can bring another reluctant case so that you will be much comfortable. നിങ്ങൾക്ക് കുറച്ചുകൂടെ കംഫർട്ടബിൾ ആകാൻ വേണ്ടി നമുക്ക് കുറച്ച് കൂടുതൽ ഇങ്ങനത്തെ റിലക്റ്റൻറ്റ് കാർഡുകളൊക്കെ നമുക്ക് ചെയ്ത് നോക്കാം. Okay, so for the rest of the students, any other doubts? A bit, but now it is clear. Okay, we can expect reluctant cases in our exams also, so please go through this explanation very well. Okay, so you can comment down your doubts or any. Ippam I got some doubts. Ippam ningal korchu doubts ennodu paranjirunnu already. Usual warm up questions, home visits, title needed. So do you have the idea about the sympathetic and empathetic phrases that you can use in your conversation? എന്തൊക്കെ phrases ആണ് യൂസ് ചെയ്യേണ്ടതെന്നൊക്കെ ഒരു ക്ലാരിറ്റി ഉണ്ടോ? അത് ചുമ്മാ എക്സ്പ്ലെയിൻ ചെയ്തു പോകുന്ന പരിപാടിയാണോ? Yes, we need like this card. Okay, so I can definitely bring up more cards. So do you have idea about the sympathetic and empathetic phrases that you can use in your conversations? എങ്ങനെ ഉള്ള കാർഡ്സ് ആണ്, ഐ മീൻ എങ്ങനെയുള്ള ഫ്രേസസ് ആണ് യൂസ് ചെയ്യേണ്ടതെന്നൊക്കെ ഡു യു ഹാവ് എൻ ഐഡിയ? If you don't have any idea, we can definitely have a discussion regarding that. No? For the rest of the students? Okay. For the other students, I am not sure whether you have an idea or not, but I can definitely give a small explanation regarding that. So, the empathetic phrases, which means we are understanding their current situation. A simple example is we had already discussed is, I can understand your situation. This is a very common empathetic phrase that we use in our role play. But after a point, idum oru repetition aanu. That is repetition of the same phrase again and again. So we need to find some alternatives for that. So what all are the phrases that you can use is, I can really sense your emotions. ഇപ്പം നിങ്ങൾ എന്തിലൂടെയാണ് കടന്നു പോകുന്നത് എന്നുള്ള കാര്യം എനിക്ക് മനസ്സിലാക്കാൻ സാധിക്കുന്നുണ്ട്. I can sense your emotions. Another one is, if I were you, I would have reacted the same way. നിങ്ങളുടെ സ്ഥാനത്ത് ഞാനായിരുന്നെങ്കിലും ഇങ്ങനെ തന്നെ പെരുമാറിയേനെ. If I were you, I would have reacted the same way. Another one is, your concerns are reasonable. This phrase needs to be used when they are expressing a concern. I can understand your feeling can be used even if they are not telling us a concern. അവർ കൺസേൺ പറഞ്ഞില്ലെങ്കിലും നമുക്ക് യൂസ് ചെയ്യാൻ പറ്റും. Okay, I can understand your current situation. അല്ലെങ്കിൽ feelings or emotions can be used. But your concerns are reasonable or I do appreciate your concern. These can be used when they are expressing a concern to us. Okay? So till now I think it is clear. The last one you can use is, I can put myself in your shoes. Same like if I were you, I would have reacted the same way. Same meaning goes there. So I think these empathetic phrases are clear for everyone. Is it clear? Just അവരുടെ സിറ്റുവേഷനെ മനസ്സിലാക്കുന്നു. We are just trying to understand their situation. Already we understood what they are going through. In order to address that, we can use these phrases. Any other doubts? Okay, I think this Empathetic part is clear for everyone. Now moving on to the sympathy. Sympathy in the sense we already know what the word means. To express our sadness അല്ലെങ്കിൽ to feel bad. Okay, അയാൾക്ക് അങ്ങനെ സംഭവിച്ചല്ലോ എന്നുള്ളതിന് to feel bad. So for that you can use the common one is I'm so sorry to hear that. അത് കേട്ടതിൽ ഭയങ്കര വിഷമമുണ്ട് എന്നുള്ളത്. This is a very common phrase that we use. And another one, this also after a point can become a repetition. So another one you can use is I'm so sorry to learn that. അത് മനസ്സിലാക്കിയതിൽ, in order to understand that, അല്ലെങ്കിൽ okay, I understood that this happened to you and I'm so sorry to know that. Okay. Another one is it is unfortunate to hear that. You can use an alternative for I'm so sorry. For that you can use it is unfortunate. Okay. Another one is I know you are going through an overwhelming situation. Or you can say I know it is an overwhelming situation for you. So is the empathetic and sympathetic part clear for everyone? Empathy partum, sympathy partum clear aano? Any doubts? Any doubts in this card? If you, any doubts in my explanation? എന്തെങ്കിലും doubts കാര്യങ്ങളോ വല്ലതും ഉണ്ടോ? Okay, for the rest of the students, do you have any doubts? Okay, if you have any other doubts in this role play card or any warm-up questions or any other specific conversations, you can comment down. Okay, we can clear it in our next session. If you have any further doubts, you can comment it down. So now, do you have any doubts regarding this role play card? Ma'am, in the third point, I know you are. Third point. Okay, I know your... Ashwini, can you please make it a bit more clear? Okay, agency warm-up questions. Okay. Okay, Ashwini, can you please make it clear so that I can explain it? Ma'am, in third point. Okay. Explain that a triage nurse has reviewed your friend. Okay. In this case, we can use, if I were you, I would have reacted the same way. But a triage nurse has already reviewed your friend and your friend will be seen very soon. Okay. Janet, in warm-up questions. Okay. Ashwini, I hope it is clear now. In warm-up questions, could you please explain about the challenges you face in nursing? Okay. Yes, challenges faced. Yes. I'll definitely do a session in our next live. Okay. Yes. So any other doubts? Any other doubts or questions that you would like to ask? എന്തെങ്കിലും ഡൗട്ട്സോ കാര്യങ്ങളോ എന്തെങ്കിലും ഉണ്ടോ? Okay, so I hope it is clear till now. So now we have come to an end of our live session. So once again, thank you all for joining the session. So hoping to see you all in our next live. Thank you everyone.